I'm Derek Chong. I'm a senior registrar. I'm a Murri and a Guri man from North Queensland and also Southeast Queensland. And my people are the Malanjali and also the Walkerman people.
So we're getting called in, so we're getting a big beep.
Receiving upstairs in 5 minutes.
We'll ignore them for the moment. What are the main issues that you want to see talked about here in terms of Indigenous mental health, and what would you like psychiatry to take away from it?
Okay. Most of the most of the sessions looked at Indigenous, trying to find the cause of Indigenous mental health issues. Now, as a clinician, I've been in this space for over 30 years. We need to go past trying to find exactly the causes, because the causes have been already written about. It's actually looking at the treatments and actually getting whole governments to understand how trauma has impacted Indigenous people, and it's not just colonial trauma, but it's also recent trauma. And so therapies that need to be focused on not just the individual, but also the collaborative and the community. They did measures to actually disrupt our families and pull them apart, but there's nothing to actually put them back together again. They talk about things to help our communities by taking alcohol away and other drugs. Well, a lot of those things are actually their medications, because it's hard to explain what they're going through, what our people are going through. But it's really important to actually, if we're going to take those things away, to implement and put something in to replace that. And it's a known neurobiological factor and neurotransmitter response to actually what's going on with Indigenous people in Australia to all around the world. And there are places in the other parts of the world that are going heads forward, and we're about 20 years behind them and actually looking at those treatments.
What's good? What can you highlight from overseas?
Well, one of the wonderful sessions that I seen this morning was from our countrymen across the sea, the Māori people, and they had a spiritual healer, if you could say, in there, and how he actually complemented, or if not, psychiatry wrapped around his knowledge, rather than him being a complement. Now, we're seeing the same results with the Nunkery in South Australia, who New South Wales Health actually adopted, and some of the treatments that they're doing, not just in mental health. Well, mental health's just adopted them, but what they've done in general mainstream health. And that's the things that we need to actually have a look at them, and we wrap around those services, well, their skills and knowledge.
Fantastic. Thank you, Derek. Now I'm just going over to Jodie. Jodie, could you introduce yourself?
Yes, I'm Jodie. I'm an advanced trainee over in Western Australia. My family and cultural background is Torres Strait Islander to the Waggatagum people.
And you've been, for a start, I was really interested to hear what you thought of the keynote today, which was by Professor Ernest Hunter, which talked a lot around remote communities. What was your takeaway from that?
I enjoyed it very much. Mostly I was just pleased that his work and the conversation around the impacts of sort of social and political policy and agenda was being broadcast to such a diverse group of clinicians here. And echo really what Derek said, that I think that conversation is important, but also then looking at solutions and pathways to move through that, and addressing trauma really in Indigenous peoples is just so important.
That was at the heart of his, was talking about the trauma that's now intergenerational.
Yeah.
Can you give us a little bit of a summary?
I would say from my perspective as a practicing mental health doctor, that that's very much seen and known just in day-to-day practice, and I think just broadening people's understanding of that and the importance of trauma, which often is minimised, I think, in practice. I think that goes a long way.
And as someone coming into the profession, what are the challenges, do you think, to do better Indigenous mental health?
There are many. I would say probably one of the biggest challenges would be looking after our own traumas and our own mental health in being able to stay strong and stay connected. That's been another real takeaway from my experience here, is connecting with the other Aboriginal and Torres Strait Islander trainees, which we're now a growing cohort, and that's an immense sense of belonging and connection, which is really very important.
And when you run up against psychiatry, mainstream psychiatry, where do you find the issues for what you know works best with community?
I guess what comes to mind, the main issue is really having an Aboriginal voice in planning, in researching, in building solutions. Really, I think if it's not coming from Aboriginal people and Torres Strait Islander people directly at all stages of development, then as we've seen, I guess, over the last, over history, they don't often work.
Thank you very much.
Thank you.